Today you're here to review your health diagnostics lab results. This panel gives us a very comprehensive, in-depth look at your health, both your risk and potential for chronic diseases. Did you know that 50% of the people who've had a heart attack have normal cholesterol? I think it's great we're going to be able to do something about those hidden risks before you actually have a medical event. Maybe you're already diagnosed with some of the conditions like diabetes, hypertension, cholesterol. If this is you, we're going to use these results to start reversing these conditions today. This lab report is too comprehensive to cover in a single patient visit. By listening to this while you're waiting for your appointment, we'll be able to dive right into the areas that are most important for you when you come back in the exam room. By digging deeper into your results, we will be able to be more proactive and create a treatment plan just for you. Truly personalized medicine. When you checked in, you were given a copy of your results. The top box, titled Lipids, composes a traditional lipid panel. Most of us who've had blood work done have seen this before. Recent guidelines in 2013 focused on the assessment of the risk, lifestyle modifications, and management of blood cholesterol and body weight in adults. Of course, they recommended everyone take a statin drug, but they also recommend advanced lipid profiling, which we have down in the next box. But before we look there, I have to point out, if you are a woman, the triglycerides and the HDL are the most predictive results for heart disease in a traditional lipid panel. For men, we really focus on the LDL. Let's start from the top. ApoP, LDL-P, and SDLDL are very atherogenic. In plain English, this means they're able to create plaque and inflammation. They can be impacted by diet and lifestyle factors as well as our pharmaceutical drugs like statins. In addition, the right omega-3s in the right dose can help us move these into the green area. Next up are some of our healthy lipids. ApoA1 and HDL are thought to be protective against heart disease, and we used to think the higher the HDL, the better. Now we know that too high HDL is actually dysfunctional HDL, and it increases cardiovascular risk. Again, lifestyle factors as well as pharmaceutical drugs can help this. The ratio of ApoB to ApoA1 is very important, and most people have never had that measured. It predicts a heart attack better than total cholesterol or LDL. When I see an abnormal here, it really motivates me to turn the lifestyle around and may lead me towards using a pharmaceutical drug if needed. Finally, LPA is extremely atherogenic particle. Unfortunately, we don't have a huge arsenal of options when this is elevated. Niacin is our mainstay treatment, and it's not right for everyone. We also maximize our efforts against the abnormals we can control and influence. Our next category is about inflammation. Elevated high-sensitivity CRP, HS-CRP, is nonspecific. We used to think it was about the heart, but it turns out to be so many things. Dental health and gum disease is an example. LP-PLA2 is an indicator of inflammation in the blood vessel walls. When this is high, we really need to get into gear and start working on our lifestyle factors. Myeloperoxidase comes from white blood cells and also can indicate arterial or blood vessel inflammation. Fibrinogen elevations are nonspecific, but can indicate increased risk of clotting. Our next section is in regards to myocardial stress. The heart is the myocardium. NT-proBNP is an early indicator that the heart muscle and valves aren't functioning as well as we would like. Basically, it's a sign that the heart is being overworked. High levels of galectin-3 indicate stiffening and thickening of the heart muscle. This can occur when the high blood pressure is not controlled, for example. Now, we're going to look at some factors that we're born with. Remember, abnormals here are not destiny, but rather give us an opportunity to be proactive. The first one is our ApoE type. ApoE4 status is our strongest known genetic risk factor for Alzheimer's. On the other hand, ApoE2 is protective. Before you get concerned, remember it is an opportunity to be proactive. We know from several large-scale studies, including of the nuns, that even when you have an ApoE4 status, you can still avoid Alzheimer's, particularly if you remain socially, mentally, and physically active. However, if you become diabetic, it accelerates the risk and progression of the disease. On the other hand, even people who are ApoE22 can get Alzheimer's. particularly if they become diabetic couch potatoes. ApoE type also can predict our response to statin drugs. ApoE4s, for example, do not respond as well as expected. Next, we'll look at how fast or slow you process certain drugs and chemicals. Although this report focuses on the drug Plavix, which is related to aspirin, it applies to more than that. Green means you're a normal metabolizer. If you're abnormal, then you're more susceptible to side effects of certain medications. Or you may be like me and able to drink espresso before going to bed. Next, we look at coagulation, which means blood clotting. Factor V Leiden is a common condition which makes us more likely to clot. The prothrombin mutation is not as common. MTHFR could be a lecture in and of itself. It is one of our biochemical pathways that our body uses to process and manufacture different substances, like our hormones, our neurotransmitters of joy, dopamine and serotonin, of focus, norepinephrine. The biochemical name of this pathway is methylation. When we don't methylate very well, we have an increased risk of heart disease, cancer, anxiety, depression, and more. In today's world, we not only have to methylate our inner processes, but all the fertilizers, plastics, pesticides, drugs, etc. These need to be methylated. It becomes really important to live clean and organic when we don't methylate very well. We have reprints of an article published in Florida Today regarding this that I wrote. We'll give it to you if you have problems in this area. Next, we want to look at your metabolic results. Insulin is key for weight loss and also creates some of the inflammation that leads to the abnormal cholesterol results on the first page. When insulin is too high, our body attempts to store as fat all the food we eat. Until this is less than 9, and ideally 7, we'll not get the results we want from any weight loss program. Free fatty acids increase inflammation as well. They also indicate to me that you're a carbitarian, something we're going to work on. Blood glucose ideally should be less than 85. As it creeps towards 100, you're developing insulin resistance. Over 100, we call it prediabetes, and over 125, you get to wear the jersey and be labeled diabetic. We work hard to bring blood glucose, insulin, and free fatty acids down into the optimal category at RHMD. Hemoglobin A1C actually measures how many red blood cells have sugar deposits. Levels greater than 5.2 are outside the ideal range, though well within normal. Remember, we not only put sugar on our red blood cells, we put it on our nerve cells, our brain cells, our skin, and these sugars age us faster and push us towards chronic disease. Again, this could be a lecture in itself. Vitamin D3 is actually a hormone, and it needs to be greater than 50 to be in the ideal range. Less than 30, and we're severely depleted. Vitamin D3 is more than just bones. It's mind, mood, memory, and our immune function. We used to give babies sunbaths, build solariums on our hospitals, and send people to the south of France when they were ill. We've thrown the baby out with the bathwater with our sun protection of the last 25 years. Not that I endorse burning. Homocysteine and B12 levels have to be viewed in light of the MTHFR status. Renal function is next, and like with the heart stress markers above, this gives me an early indication of your kidneys' health. Next, we're going to look at your high sensitivity omega-3 index, HS-omega. At a very basic level, healthy omega-3s reduce inflammation. But like vitamin D3, we need to know your levels to know if taking them or more of them will help with your risk of heart disease. In the lower right on this page, your trans fats are measured. Trans fat intake is the #1 nutritional factor associated with heart disease and sudden death. Our goal is less than 0.1%. Did you know that products containing less than 0.5 grams of trans fat per serving can actually be labeled as having 0 grams of trans fat? Anything made with partially hydrogenated vegetable oils contains trans fats. Finally, we're going to discuss your sterol absorption and synthesis markers. We can absorb our used cholesterol from our intestines, which is where we get rid of it. Overabsorbers are at higher risk of heart disease. By using the plant sterols and stanols, as well as absorption-inhibiting drugs, we can reverse this risk. Fiber is also a natural inhibitor and is often my first-line natural intervention if you're an overabsorber. The guidelines are simple. A woman needs 25 grams of fiber a day and a man 38. At least half of that should be soluble fiber. Remember, if you haven't been eating that much, too fast will cause a lot of tummy trouble. Now we're ready for your appointment and to discuss a targeted treatment plan for you. Thank you for listening.